Have you noticed a strange bulge in your abdomen or groin? It could be a hernia. I'm here to explain what a hernia means and talk to you about the latest treatments. Let's cover everything you need to know about hernias. Hello, my name is Raj Peravali. I'm a consultant general and colorectal surgeon in and around the West Midlands. One of the many things that I deal with are hernias, and I want to provide you with clear, concise information about hernias and how to manage them. What is a hernia? Here is what you need to know. Firstly, a very fundamental question. What is a hernia? A hernia is a protuberance or bulge from a cavity through a weakness. The ones that I deal with are in and around your abdomen and in your groins. Hernias can occur in several places, and these places are where there are natural weaknesses within your abdominal wall. The commonest places are in your groins. These are known as inguinal hernias. You can also get something called femoral hernias in your groins, although these are less common. You can get hernias around your belly button. These are known as umbilical or para-umbilical hernias, and anywhere in your abdomen between your umbilicus, which is your belly button, and your chest bone. These are known as ventral or epigastric hernias. Other areas of weaknesses around your abdominal wall are where you've had an operation, an incision for surgery for another reason. These incisions cause hernias known as incisional hernias. The other areas that I deal with particularly are in people who have stomas, colostomies or ileostomies. People often develop hernias around their stomas, and these are known as parastomal hernias. All these hernias are treatable and repairable, usually by surgical means. What does a hernia actually feel like? This is for you. Hernias can present in a number of different ways. The most common symptom that people experience is just a bulge, if you like. These bulges can happen anywhere where the hernia is. They often feel like a squidgy lump that you can push back into your tummy. When you have these lumps, it's important to get them assessed, and the management depends upon where this lump is, and your surgeon can explain all of these things to you. Other symptoms that a hernia can present with: it can often cause pain. Pain is worse during activity, and often many of my patients describe the inability to do the physical work that their job involves. Some people describe significant pain after walking, after going to the gym, after playing golf. All of these things are very important to the lifestyle of an individual. Hernias can also present with some very severe symptoms that should not be ignored. These are symptoms that, if present, need to be assessed in the emergency setting. You need to go to the emergency department and be assessed, managed, and dealt with. The red flag hernia symptoms, if you like, are significant pain. Pain that is nothing like you've ever experienced before. A very hard, irreducible lump. That squidgy lump that was present before is no longer squidgy, it's very hard, and you're unable to push it back in. Thirdly, if the pain is very severe and extends beyond the hernia to the other parts of your abdominal pain. All of these things mean that you need to be assessed quickly, rapidly, and require treatment. Are you at risk of a hernia? Here is what you need to know. The first thing to say is that hernias are very common. They present in many people, and often people have them from birth, and they just become more noticeable in older age when you're doing more activity. They tend to happen in areas of natural weakness. These are in the groins and the abdomen, around your belly button, and over where you've previously had an incision or surgery. Things that cause hernia to develop are anything that causes the pressure within your abdomen to increase can contribute to developing a hernia. This might be a chronic cough. This might be significant straining when you're going to the toilet. And this might be other things like pregnancy and obesity. People who have manual jobs that require lifting heavy objects are also more predisposed to hernias. Sometimes hernias are acquired, and this means that muscles tear or break, causing a weakness, and this is more common in people that do manual work. Another risk factor for hernias is increasing age. As we get older, our tissues are less strong. They are weaker and they stretch more. This means that any areas of natural weakness are further weakened, making hernias more common. What to expect when you see a doctor for a hernia? Listen to this. People often present with pain in their groins or pain around their belly button and don't often notice a lump. It is important for you then to be examined by a surgeon to assess why you're getting pain in these areas. Sometimes it is the surgeon or the clinician that picks up the hernia and you may never have noticed it before. Often, repairing the hernia improves the pain. If you're worried about a hernia, you need to see a specialist. The specialist will take a full history. The history will involve what you do for a living, when you first notice the pain, whether the pain is worse on coughing, sneezing, whether there's any interaction between the pain and bowel movements. All of these things are important considerations. Is the pain or the lump restricting activities? Is the pain or lump worse after prolonged activities? Is it interfering with your work? Is it interfering with your personal life? All of these things are important considerations that your surgeon will take on board. Following the history, your clinician will examine you. This usually involves examining your abdomen or the area where the bulge is. And things that the surgeon is looking out for is, how big is the hernia? Are they able to push it back? Is it particularly painful? Management will then depend upon the findings. Sometimes it's not immediately obvious whether there's a hernia or not. In these situations, the clinician may choose to do some investigations. The commonest investigations for these are CT scan or ultrasound scans. In rare circumstances, we may well do MRI scans. Sometimes, especially with very big hernias, the clinician wants to define the hernia or the defect or the weakness prior to discussing the most appropriate treatment strategy with you. In these situations, I would also do imaging or a CT scan to guide the kind of hernia repair that I will do for you. The best treatments for a hernia. Listen to this. So once a hernia is diagnosed and you've seen a clinician, there are several management options. The management options will depend upon the patient and the particular type of hernia that is present. Generally speaking, hernias need to be managed by surgery. Now, surgery is only appropriate if the patient is fit enough for surgery. If the patient or the individual has severe heart problems, breathing problems, diabetes, is very obese, all of these things increase the risk of surgery. The surgeon and the patient need to balance the risks of surgery versus the success of surgery and the improvement that can be gained by operating. So it's often a very joint decision-making process, and if appropriate, we will proceed to surgery, and if not appropriate, we will consider other management strategies. In individuals where surgery is not appropriate, for example, high-risk individuals, or in patients where the hernia is not causing any problems whatsoever, it may be appropriate to do conservative measures, things like using a support belt, things like addressing the chronic cough, things like addressing the constipation, things like suggesting weight loss can all improve symptoms from the hernia itself. Hernias, however, can only be repaired by surgical means. Hernias can be repaired by minimally invasive means or traditional open methods. Traditional open methods again vary depending upon the type and site of hernia, and your clinician will talk to you about these when they examine you. Often repairs involve inserting a mesh. This provides a lattice for your body to remodel and strengthen the area to reduce the chance of the hernia returning. In addition, the most common hernias are often treated by minimally invasive means. These are keyhole surgery and often robotic surgery. Robotic surgery is an area that I particularly specialize in, and I think it's very good and particularly advantageous for hernia repair. This means that we can do very precise surgery identifying nerves and do a much more sound repair with better results. This is particularly the case for groin hernias such as inguinal and femoral hernias. In particular relation to groin hernias, the two options are open hernia and keyhole surgery. Generally speaking, keyhole surgery means that individuals have less pain, they get up on their feet quicker, and they have a quicker recovery. Within keyhole surgery, you have the traditional laparoscopic keyhole surgery or the robot-assisted keyhole surgery. The robot-assisted keyhole surgery is what I specialize in particular, and it enables even more precise surgery, avoiding nerves, reducing pain, and getting a much more sound repair. What to expect after your hernia surgery. Listen to this. Life after hernia surgery, what you need to know. So hernia surgery, by and large, is day case surgery. That means you're in the morning of surgery and home later on that day. I would expect you to be walking immediately after surgery. I'd be expecting you to be walking upstairs on the day of surgery. You will be in pain, so you will be given painkillers. Generally speaking, it's 6 weeks before you can do heavy lifting or contact sports, play golf, play rugby, play football, that sort of thing. Generally speaking, it's about a week or 10 days before you can drive. You must be able to get into the car, you must be able to do an emergency stop and not feel a thing. You also need to let your insurance company know that you've had surgery and to make sure you're covered. Different insurance companies have different policies for driving after hernia surgery, so you do need to make sure that you inform them. You'll have glue dressings, so this is like super glue over the dressings. This is completely waterproof that enables you to shower. I will generally see you in clinic about 6 weeks after the operation, and by that time you should be doing everything completely normally. My name is Raj Perivalli. I'm a consultant, general and colorectal surgeon. I specialize in hernia repairs and hernia repair surgery, particularly robotic hernia repair surgery. If you'd like to make a consultation appointment with myself, please follow the link below.